And now back to, of course, our story tonight. UNAIDS is calling on countries to make far greater investments in global pandemic responses and adopt a new set of bold, ambitious, but achievable HIV targets. The organization says if those targets are met, the world will be back on track to ending AIDS as a public health threat by 2030. Joining me now to talk about this is the director of UNAIDS Regional Support Team for Eastern and Southern Africa, Anias Chuma. Anias, good evening, and thank you very much for your time tonight on the Newsfeed Late Night.
Thank you for inviting me.
Talk to us then about how the COVID-19 pandemic and the environment in which we are in right now as we commemorate World AIDS Day has created additional setbacks in as far as responses from various countries, particularly in the continent.
Well, thank you very much indeed for inviting me. COVID-19 is largely impacted negatively on the response, HIV response, in several respects. One way is that there were just some disruptions to services that were available to people living with AIDS or other people that are affected by AIDS. And we've seen in some cases when the health systems are overwhelmed, the tendency to redeploy or repurpose financial and technical resources to the COVID-19 and away from the HIV response going forward. So all these things have been unexpected, and it does just apply to HIV, it does also apply to other sectors as well.
Yep.
Going forward. So these are the issues that we have had to deal with. Fortunately, governments, particularly in our region, have been able to respond within their means to ensure that the HIV services continue, even though they face challenges from COVID-19 because of fragile health systems.
What would be the long-term impact of the pandemic on the HIV responses in the region?
Well, and I think there is need by governments and other partners to recognize that you can't fight one pandemic by, drawing away resources from another pandemic, as it were. So you need a coordinated approach, one that will, continue the services created and operationalized in the response to HIV. But also find additional resources and strengthen health systems, to respond to the COVID pandemic. Now, it's also very clear that there will be other pandemics. So the larger debate now is how to strengthen state capacities to respond to pandemics, especially pandemics that can happen simultaneously and they can feed on each other. In terms of limited, and fragile health systems. I think that's a very important debate.
Yeah.
Because if you look at the COVID-19, practically, be it in the developing world or in the developed world as well, citizens ran to government for support. They didn't run to the private sector. Not to say that the private sector is unimportant. But it was to government. And what it means then, you have to rethink the capacities of states to respond to public threats such as the COVID-19 pandemic.
Yeah. Speaking of capacities of states, I mean, when we speak of health, when we speak of the HIV programs, we, of course, say they must be funded, both in times of plenty, but also in times of economic crisis. However, in a reality, looking at this pandemic that nobody planned for, nobody could have envisaged that 2020 would turn out like this, a lot of countries are looking internally because, of course, especially first world countries have got significant challenges in terms of numbers, more than one would say third world countries like those in the region. But what is your view on how we could still be looking at improving the health systems in our own countries, but yet have a global approach to dealing with HIV and AIDS?
I think that's precisely the solution. The COVID-19 is not a national pandemic. It doesn't respect borders. It cuts across borders. And when it did it almost simultaneously. So you need a global response global solidarity. I think the initial reaction, naturally has been to focus on protecting one's own borders, but it doesn't recognize borders. You can't legislate COVID-19 virus out of your country. So the important part, as you mentioned, is to have solidarity, a global approach. And right now, again, you see a race towards vaccines. Okay, it's good that vaccines are being developed, but there's just too much competition. And sometimes competition is not necessarily good in that respect. It could be disruptive because, especially in situations where the survival of humanity is concerned. So you see now competition in the US, in the UK, and also previously we've seen in China and Russia towards the development of the vaccine, which is well and good, as long as the vaccine can be made available to all poor countries equally, so that we save all humanity, not just those that are capable of paying. But what's worrying now is the fact that the rich countries have now been buying large doses of the vaccines before they're even made, and stockpiling them. And it calls questions about the capacity of developing countries basically to procure. So there's a call to encourage that vaccines should be made available to save all humanity, not just the rich countries.
Right.
As it were.
Talk to me then about some bright spots in the region when it comes to leadership, when it comes to infrastructure, and how they've used lessons that were gleaned from fighting the HIV/AIDS epidemic during this time of COVID-19.
Well, I think there are several countries that have invested in infrastructure. If you look at South Africa, for example, it's one of the few countries that is largely funding its response to HIV from its own resources. Because one of the challenges in a lot of countries is that there's too much dependence on external funding. And in situations such as what we face now, where our main donors have been affected by COVID-19 in terms of disruptions to the economy, declines in revenues, and also the need to respond to domestic demands. It means that the funding of the pandemic is to largely come or progressively from domestic resources. South Africa has done well in this respect. We had targets for 2020. Not all of them have been met, but of the 14 countries in the world that have met or exceeded these targets, 5 of them are in the East and Southern Africa region, including a country like Eswatini. So you see positive trends globally and also locally. But what is important, which is a major message from the World AIDS report of today, is that there is global solidarity, there is global responsibility for a pandemic that affects all of us, not just a particular country, and it doesn't respect borders and cannot be contained within borders.
Ernest Chuma, I appreciate your time. Thanks for joining us tonight, the Director of UNAIDS Regional Support Team for Eastern and Southern Africa.